Welcome to Pharma Knowledge Hub. In this channel, we will discuss about the pharma related topics like pharmaceutical analysis and pharmacology, human anatomy and physiology. Like these subjects we will discuss about in this channel. In our today class, we will discuss about the anti-tubercular drugs. Pharma knowledge hub means which give the knowledge about the pharmacy and also the some important tricks and mnemonics we will discuss in this channel about which are used for the GPAT and NIPER examinations. Okay. Now today topic is anti-tubercular agents. The anti-tubercular agents, what are the anti-tubercular agents? What is meant by the anti-tubercular agents? The anti-tubercular agents, which are the drugs which given to patients who has the tuberculosis. And what is meant by the tuberculosis? How it is caused? It means tuberculosis is a disease or infection which caused by the mycobacterium tuberculosis. This is the bacteria which caused by the bacteria. The tuberculosis caused by the mycobacterium bacillus bacteria. This tuberculosis we will see in the lungs. Okay. Mycobacterium refers to the genus of acid fast organisms, and an anaerobic and non-motile bacterium, the Mycobacteriaceae is the family of Mycobacterium tuberculosis. Okay, the genus includes pathogens which cause the serious disease in mammals, including the leprosy in humans. Okay, the leprosy also caused by the Mycobacterium leprae, and tuberculosis caused by the Mycobacterium tuberculosis. These are the two bacteria which is dangerous, which causes the dangerous diseases in human beings. And tuberculosis mostly affects the lungs. We already discussed about this. This tuberculosis mostly affects the lungs, but can spread through the bloodstream and lymph nodes, and then it will be spread to the brains, bones, eyes and skins. Okay. And here the latent tuberculosis, most infections do not have symptoms. In previous days, in olden days, the latent tuberculosis, most infections do not having symptoms. In that case, they are known as the latent tuberculosis. That's why it is called as latent tuberculosis. It means a patient is infected with Mycobacterium tuberculosis, but the patient does not have the active tuberculosis. Okay. The patient infected with the Mycobacterium tuberculosis, but the patient does not have any active tuberculosis. About 10% of latent infection progress, the active disease cause untreated, and it kills about half of the infected. That's why this is called as latent tuberculosis. The classic symptoms of tuberculosis are chronic cough with blood containing sputum, and fever and sweats and weight loss. These are the major symptoms of tuberculosis. What are the symptoms? Means chronic cough with blood, and chronic cough, blood containing sputum, and fever, chills, weight loss will be observed in these tuberculosis symptoms. And here comes to the transmission tuberculosis. This is spread through the air, and So that's why the tuberculosis is affected by one person to the another person when we are air. By air means the air will be contaminated, then it will be spread by the air also. The bacteria will be present in the air atmosphere, so that it caused by the one person to another person. And if the person shares water one person to another person, then it will be food, it will be caused by the food, water, air. These are the transmissions of the tuberculosis. And when what are the major transmission of the tuberculosis means, here some are given in this. Okay, the tuberculosis is spread through the air. When people who have active tuberculosis in their lungs, they will be, when they are cough, split, speak or sneeze, then the tuberculosis will be transferred from the patient to the another person. Okay, people with latent tuberculosis do not spread the disease. Who has latent tuberculosis, they does not spread the disease. And active infections occur more often in the people with HIV AIDS and those who smoke. And this tuberculosis mostly caused to the HIV patients, AIDS patients and who smoke a lot. Okay, and what is the diagnosis of active tuberculosis? Here we can see the diagnosis of active tuberculosis is based on the X-rays. Okay, X-rays as well as microscopic examinations and culture of the body fluids. Then the diagnosis will be occurred. And some tests also there. They are tuberculosis skin test or blood test. These tests are performed by the patients who has tuberculosis, and they will be defined as the tubercular disease. And first these tuberculosis discovered by the Robert Koch. Robert Koch was discovered the tuberculosis. And Albert Calmette and Camille Guerin achieved the first genuine success in immunization against the tuberculosis in 1906. In 1906, Albert Calmette and Camille Guerin, those scientists achieved the first genuine success in immunization against the tuberculosis by using the attenuated bovis strain tuberculosis. It also called as Bacille calmette guerin. We already know that BCG vaccines. And these BCG was first used on the humans in year 1921 in France country. Okay, and the common infections of tuberculosis are lungs, brain, bone, liver and kidney. These will be commonly affected by the tuberculosis. And the main symptoms of tuberculosis are cough, tachycardia, respiratory failure and cough with the blood containing sputum, fevers. These are the, and this will be depend upon the site and symptoms of the infections. This is differentiate between the person to person, varies to the person to person. Okay, and these tuberculosis will be classified into 4 types. They are pulmonary tuberculosis, genital tuberculosis, tuberculous meningitis and miliary tuberculosis. Here pulmonary tuberculosis also called as respiratory tract. So it mainly caused the respiratory tract. And genital tuberculosis, the mainly infected organ is genitourinary tract. And tubercular meningitis, mainly infected organ is nervous system. And miliary tuberculosis, it is a widespread infection in all classifications of the tuberculosis. The anti-tubercular agents. What are the anti-tubercular agents? The drugs which are used to treat the tuberculosis are called anti-tubercular drugs. They are classified into two types. They are first line agents and second line agents. The first line agents are contained isoniazid, ethambutol, rifampicin, streptomycin, pyrazinamide and rifabutin. These are the first line drugs of tuberculosis. These are effective bacterial agents which are having high action and high therapeutic value and which are having low toxicity. Okay, and when we move to the second line agents, that is nothing but which shows high toxicity and low therapeutic value. The drugs are ethionamide, aminosalicylic acid, cycloserine, amikacin, capromycin. These 5 drugs are came under the second line agents of tuberculosis. The main mechanism of tubercular drugs or anti-tubercular drugs main mechanism is, what is the main mechanism of anti-tubercular drugs? Which inhibit the growth of Mycobacterium tuberculosis by involving the mycolic acid synthesis. This mycolic acid synthesis is performed by the drugs which are taken anti-tubercular drugs. They are first line drugs or maybe second line drugs. Okay, that depend upon the toxicity and range of the patient and diseases, and also inhibit the peptidoglycan synthesis. The peptidoglycan synthesis inhibited drugs are cycloserine, meropenem, impenem. These are the 3 drugs which inhibit the peptidoglycan synthesis. And inhibition of growth of Mycobacterium tuberculosis drugs are isoniazid, prothionamide, ethionamide. These drugs are taken in the combination of, because the drugs are taken in combinations because which showing the effects. And these tubercular drugs like isoniazid, rifampicin, ethambutol, these are also used in the treatment of leprosy also. These drugs are used in the leprosy treatment also because the leprosy are also caused by the Mycobacterium leprae, same family containing bacteria. So that's why these drugs are also used for the Mycobacterium leprosy disease. And the drugs which inhibit the synthesis of cell wall is ethambutol, amoxicillin, clavonic acid. And inhibition of adenosine triphosphate synthesis drug is bedaquiline. And last one is protein synthesis inhibition. Protein synthesis inhibited drugs are amikacin, kanamycin, capromycin. According to this mechanism of actions, the drugs will be classified by the categories like inhibition of growth, synthesis, and inhibition of peptidoglycan synthesis, and inhibition of cell wall synthesis, and ATP synthesis inhibition, and protein synthesis inhibition. This is about the anti-tubercular agents. You can see here anti-tubercular agents. This is the about class, introduction and classification and main mechanism of action of anti-tubercular agents. This is about the anti-tubercular agents, introduction, classification and mechanism of action.